Have you or someone you ever cared about ever struggled with their weight? Today, more than 1/3 of adults in the United States are currently overweight, with trends continuing to increase. Obesity rates today are higher than they have ever been in the past. With these rises in obesity, increases in cardiovascular disease, type 2 diabetes, and different types of cancer. My name is Amber Harmon. Today I'll be talking to you about a controversial topic within the Department of Nutrition and Dietetics, the cause of obesity. As a nutrition science student, this is a topic we have spent a great deal of time on within my 4 years here at UNL. Many different professors have provided an array of opinions and options. Some believe that obesity is a patient's own fault and is a result of their lifestyle choices, while others believe weight is predetermined and is a result of their genetics. The goal of this speech today is for you to understand that our genetics plays the greatest role in determining how we maintain our body weight. So today we will investigate cases of twins and adopted individuals. We will look at genes that can increase our risk of becoming obese and how different genes can affect different treatment options. You may have heard the statement, calories in equal calories out. It's like a scale. What this means is if we burn off the same amount of calories that we're taking in, we should maintain the same weight, but this isn't always the case. One big misconception that we have is that obese or overweight individuals sit on the couch and eat all day long. And this is not okay because this is not usually true. One thing to keep in mind is that two individuals can have the exact same diet and follow the exact same exercise regimen and be on two complete different spectrums. One can remain relatively thin while the other remains obese. And this simply boils down to our genetics. If a child has two obese parents, there's an 80% chance they will become obese. With one obese parent, a 40% chance. And even without either parent being obese, there's still a 14% chance that child may become obese. While this is partially influenced by the environment, such as socioeconomic status, their diet, and their exercise, the genetic component is much stronger. In a case that was done by Bordenson in 1976, they found that the BMI of adopted children was much strongly correlated with that of their biological parent than that of their adopted parent. In the case that was done of identical twins separated at birth, they found that the twins had more similar BMIs to each other than with their adopted parent or sibling. And this reinforces the idea that the genetic component is has a greater impact on how we maintain our body weight than does our environment. There's also an allele, or a gene, called the FTO allele, and this is a variant form of a gene which increases our risk of becoming obese. One copy of the allele increases our risk up to 30%, while two copies increases it up to 60%. This allele is more common in those of European and African descent, and least common in those of Asian descent. And this was found parallel with a study done by Gallup in 2012. In the United States, whites and African Americans were the most obese group in the United States, while Asians were the least obese group in the United States. The presence of the FTO allele gene has also influenced how different treatment options and their effectiveness. One type of treatment, bariatric surgery, while there are many different types, has been greatly affected by this. Those who had the FTO allele lost 3 less pounds after bariatric surgery than those who did not have the allele. Pharmacotherapy is another type of treatment, also known as drug treatment, and right now there's primarily only general treatment options out there, which are not very effective. There's only one patient-specific drug out there, and that is the use of leptin. So we're currently doing research to find gene-specific drugs to help patients lose weight. So in conclusion, while our genetics are not meant to be an excuse for being overweight or obese, they may explain why some individuals have an easier time maintaining weight than others. Today, we talked about how the FTO allele gene can increase our risk of becoming obese, as well as impact different treatment options. We looked at studies studying twins and adopted individuals and saw stronger correlations with biological family members than adopted family members, indicating that the genetic component is much stronger than the environmental component on how we maintain our body weight. So if you're following all those nutrition and exercise guidelines and you're still not losing the weight, it's likely not your fault. So don't be so hard on yourself. You just picked the wrong parents. Well, thanks for listening.